All right, party people. Today, we're going to be covering venous disease. Here's what you need to know. Venous disease is due to valvular incompetence. It's usually idiopathic or familial. The patient doesn't necessarily need to have varicose veins. The varicose veins is just one type of venous disease. Now, typically, diagnosis via ultrasound. This can demonstrate venous backflow or valvular incompetence, even in the absence of visible varicose veins. This still qualifies as venous disease. As far as DVT goes, that's deep venous thrombosis, and superficial thrombophlebitis, both can be considered venous diseases. But a patient may also just have chronic venous incompetence without a DVT, superficial thrombophlebitis, or varicose veins. Peripheral pulses are normal. Remember this because the arteries are unaffected. It's the veins that are the issue. The veins do not carry the pulse. That's the arteries. So peripheral pulses are normal. In terms of pathophys and skin changes, in valvular incompetence, the hydrostatic pressure builds in the peripheral veins and venules. This leads to the extravasation of fluid and hemosiderin. This causes the skin discoloration over time and is often described as brown edema. On exams, you may also see this as post-phlebitic syndrome or stasis dermatitis. Now, in terms of ulcers, peep these images. On the left, you're going to have an arterial ulcer. On the right, you're going to have a venous ulcer. Notice that the arterial one is the classic punched out lesion, usually found on feet or toes, distally. On the right, the venous ulcer is seen as large, sloughy, and typically located on the medial malleoli. You're going to have to be able to spot diagnose these. Just burn this in your memory. In terms of diagnosis and management, the first step for venous disease is always ultrasound. Okay? Always. Now, in terms of compression stockings, it's almost always the next best step. Now, in image-based questions, if they show you the brown edema and note valvular incompetence on ultrasound, you have to pick compression stockings. I know you read in your textbook about sclerosing agents and vein stripping. That is not the correct next step on USMLE. You got to get familiar with ultrasound followed by compression stockings. That's bread and butter. As for thrombosis, valvular incompetence increases the risk of DVT or superficial thrombophlebitis. This is due to venous stasis and turbulence. For DVT, this is usually in the femoral vein. It presents with painful, swollen legs. Diagnosis is made by, you guessed it, ultrasound. For superficial thrombophlebitis, this presents as a painful, warm, palpable cord at the ankle, and it may extend toward the knee. Now, for DVT or superficial thrombophlebitis, the treatment is heparin. So in a case where they present to you superficial thrombophlebitis as the diagnosis and offer you compression stockings as an option, this is wrong. Enoxaparin is the correct answer since it's an active clot. So think about it that way. In the case of an active DVT, compression stockings is not the correct next step. The next best step would be enoxaparin or heparin. All right, that's it for this one. Go crush it.